Okay, class, so I've expected you guys to read the chapter of dental sealants, and then for today's class, this is our class agenda, and we're going to go through the PowerPoint, we're going to watch a video, and then we're going to take a quiz at the end to see how you guys comprehended everything. So, this PowerPoint is going to be on dental sealants. So the objectives today are going to be discuss the factors determining the success for a sealant, list the indications and contraindications for applying a sealant, describe the acceptable but different methods for preparing the enamel surface for a sealant, summarize the steps of applying a sealant, evaluate a place sealant regarding proper isolation, coverage, and defects, and then explain the importance of recalls visits for sealant maintenance. Do you guys have any questions?
No.
Okay.
No.
So, success of a sealant is determined by the proper placement and retention. The most common reason for sealant failure is inadequate isolation and subsequent contamination. The purpose is to flow into the deep pits and fissures and allow the material to flow into the areas of the occlusal surface and seal them from bacterial activity. So this is before a sealant, sealed tooth with the deep pits and fissures, and then this is one with the sealant in it as well. Inadequate and contraindications and indications. So indications are elevated risk for caries, incipient caries within the enamel in pits and fissure areas, existing pit and fissures anatomically susceptible to decay, and then the contraindications are on tooth surfaces that have frank caries or surfaces that have well coalesced pits and fissures. So I'm just going to pass this around and you guys can check. So right here is where the deep pits and fissures are of each tooth. So where there's like deep grooves in every tooth, mostly the molars, the premolars, is where sealants would be placed. So you guys can kind of look while I go through the PowerPoint. So the procedure for sealants is, so number one, surface preparation. First, use a Profi brush at a low speed with non-fluoridated pumice and clean the occlusal surfaces of the tooth. Rinse for 10 seconds after and dry the surface. Etch the pits and fissures with 37% phosphoric acid etchant material for 30 seconds. Rinse material off for 15 to 20 seconds. Use the HVE when rinsing so the material, minimal material gets ingested. Etched tooth surface. The etched tooth surface should look chalky, white, or frosty. So as you can see in the picture, this is where the etching is placed, and then it should look frosty white after you're done rinsing it and drying it. The third step is to isolate, or isolation can be accomplished in two ways. So you can either use a rubber dam or a cotton roll application. For the rubber dam, it is recommended for more than one tooth in a quadrant to be sealed. And then the cotton roll application is used with a saliva ejector and a Garmer hold for cotton rolls for the mandibular, and then you use a dry angle for the maxillary. Just make sure that the tooth is fully dry, and then you can use that with the air water syringe. So just make sure that you dry the tooth, and then you place these, and then you dry again to make sure that everything is dry. And then it's going to apply the sealant to the tooth. So make sure to remove excess amount of material. The attempt to eliminate any bubbles occurring within the sealant, and then extend the sealant material along the planes of the cusps. And then you can use a microbrush at the end and can be used to remove excess sealant material out. So if you overseal and you think it's too much, just kind of dab the microbrush on top to just take the top surface so you don't have to take it down when you're done and it's sealed and hardened. So this is what the microbrushes look like, and then that's a tooth being sealed. And then 5, you polymerize the sealant. So that's the light activated sealant, and that's what we use in the dental clinic. So use the light shield during curing process because it protects your eyes from the blue light, because staring at that is harmful to your eyes. So hold the tip of the curing light as close as possible to the tooth. And it says the curing time should be 20 to 30 seconds, but sometimes if it's still kind of sticky, you can do an extra 10 to 15 seconds. And then at the end, you have to evaluate the sealant. So visually and tactically with the Explorer, inspect the sealant for complete coverage of pits and fissures. Abscesses avoids bubbles and defects, so just make sure there's no bubbles in it and you can tell when you're poking at it. And then attempt to dislodge the sealant with the Explorer. If it comes out, replace the sealant immediately by re-etching and resealing. So if you're kind of digging hard into it and it pops right out, then you need to redo it because something went wrong in the process. And then you can use floss in between teeth that you sealed, and then if there's adjacent tooth that's not sealed to a sealed tooth, do it in between there because it sometimes can get between those areas. And then for your follow-up evaluation, the dental hygienist will reevaluate the sealed tooth surface for exposure to voids, possible caries, sealant loss, and then you can do that by visually and tactically. And if sealant is partially lost, attempt to dislodge the remaining material out with the Explorer. So if half of it's gone, just try to take the other half of it out. If it doesn't come out, then just re-etch in the area that is missing, and then you can seal that area as well. And then that's it for my PowerPoint, and then I have a video for us to watch on sealants to kind of give you a better understanding. So we can watch this video.
Deep pits and fissures are the source of some 80% of tooth cavities. This is mainly because food and bacterial plaque lodge in these tight crevices and are often inaccessible to toothbrush bristles. Plaque acids and enzymes at the base of these grooves cause the tooth enamel to dissolve, eventually leading to cavities. Over the years, many attempts to stop pit and fissure tooth decay have been made. Here are the most common, their strengths and weaknesses. Fissurotomy, or prophylactic odontotomy, involves funneling the grooves open with a cone-shaped dental burr. If done early enough in grooves that do not extend through the dentin layer, it may be possible to perform this procedure and nothing further. More commonly, however, the deepest pits and fissures do extend close to or into the dentin layer, and this procedure must be followed by placement of a filling of some type. The procedure must also be performed by a dentist, since it involves removal of tooth structure. The grooves can also be cleaned out less invasively with a microabrasion handpiece, which sprays a stream of abrasive particles deep into the pits and fissures to remove plaque bacteria and roughen the enamel surface. Since microabrasion doesn't completely eliminate the deep, narrow crevices, it is usually followed by placement of a dental sealant. If the preparation of the groove extends into the dentin layer of the tooth, the filling is placed instead. Following thorough plaque removal from the pits and fissures, the tooth is isolated from all mouth moisture, and the grooves are etched with a mild acid solution. This produces a microscopically roughened surface into which the sealants will adhere. The sealant is then applied to the grooves as a viscous liquid, which hardens on its own or by exposure to a blue light. Once placed, the sealant prevents bulk plaque from being able to accumulate in the pits and fissures. But sealants do have some potential downsides. It is possible for microleakage to occur along the sealant, especially if moisture is present when the sealant is placed. If leakage does occur, it may be difficult to detect until a large cavity develops beneath the sealant. It's important to remember that sealed teeth are not completely resistant to tooth decay. It's a big mistake to relax nutrition and oral hygiene standards on the belief that sealants alone will prevent cavities. Remember to see a dentist regularly to have the sealants evaluated for signs of failure, part of any thorough oral exam. Left alone, a poorly contoured failing sealant like the one shown is at least as prone to decay as an unsealed tooth.
Okay, so do you guys have any questions?
No.
Alright, so then now we are going to pass out the quiz, and then after you're done, you guys can leave. Thank you.